Hi, I am Dr. Arsalan Khan, and today we are going to discuss the emerging epidemic and zoonosis of monkeypox disease. Monkeypox is a viral zoonotic disease characterized by the skin lesions. The skin lesions resemble the smallpox disease, but the case fatality and signs symptoms of the monkeypox disease are less severe as compared to the smallpox. The cases of monkeypox disease in are being reported to World Health Organization since 13th May of 2022 by the non-endemic countries. Non-endemic countries are those countries in which the disease was not prevailing at first but latest epidemic has surged the cases. These countries include Canada, Australia, Spain. However, it should be kept in mind that the monkeypox disease was endemic, was prevailing in the West and Central Africa. The causative agent of monkeypox disease is Monkeypox virus. This is a double-stranded DNA virus which belongs to a genus Pox virus and family Pox Viridae. It is interesting to know that the causative agent of recent outbreak of lumpy skin disease in animals and monkeypox disease in human beings, both of these bear causative agent which belong to the family Pox Viridae. Monkeypox virus was first identified and isolated from the monkeys in Denmark in 1958. These monkeys were kept for research purpose and those monkeys were infected with the monkeypox virus bearing characteristic lesions on their skin resembling to the smallpox as we have discussed in the epidemiology of the disease. Later on, the virus was also isolated from the human beings in 1970. The disease is transmitted from animals to human beings by bites and scratches. This process of transmission of disease from animals to human beings is called zoonosis. So disease has zoonotic potential. Also, the disease can be transmitted from one person to other person, from the infected people to the healthy community. This is called contagious potential. So disease is zoonotic as well as contagious in nature. Most oftenly, the disease is transmitted by the air droplets through respiratory tract or respiratory route. Also, the skin abrasions and wounds also bear risk of transmission of the disease, and the fomites also play an important role in the disease transmission. Fomites mean those non-living objects which can transmit the infection. For example, bedding, clothing material, utensils which are used by the infected person. So the major routes of infection of the transmission of disease are three. The first one is respiratory tract, the second one is abraded skin or wounded skin, and the third one is the mucous membrane of eyes, which is called conjunctiva, the nasal septum, or oral mucosa. So these three routes, the respiratory tract route, the wounds, and the mucous membrane, these are responsible for the transmission of disease from infected person to the healthy people. Incubation period of the disease ranges from 10 to 14 days. Most often, the incubation period of the disease is 2 weeks. Incubation period is defined as the time period from entry of the organism into the body and onset of the sign and symptom of the disease. So this gap and this duration in which the infectious agent is multiplying and dominating the host immune system and shows the sign and symptom of disease it is called incubation period. So this disease bears 2 weeks of incubation period. Mortality rate of the disease is 10 to 17%, but it should be kept in mind that the disease incidence and case fatality rate are the mortality rate of the disease. It is higher in children as compared to the adult people. Adults may survive from the disease, but children, if the complications occur, may die during the disease course. So the mortality rate is higher in children as compared to the adults. Now we will discuss the clinical signs of the disease. At the initial stage or progression of the disease, the skin lesions are not prominent. General signs of the disease are evident during this course. These may be fever, malaise, headache, muscle ache, the body pain, the swelling of lymph nodes, and up to some extent, rash on the body. So these are the initial signs of the disease. But after 3 to 5 days, the characteristic skin lesion, the pox-like lesions appear on the skin. These lesions extend from the face throughout the body and trunk. The monkeypox disease lesions resemble the smallpox disease, but as we have stated earlier, that the monkeypox disease symptoms and case fatality rate is less severe than the smallpox disease. The characteristics of the lesions of monkeypox virus disease are these are raised from the skin, deeply innervated to the skin. The lesions are circumscribed or rounded. These are firm or hard to touch. These are highly painful and pruritic. Pruritic means that the itching occurs on these lesions. So as these are spread throughout the skin or throughout the body, so the body is pruritic and itching. Along with it, there is fever and sore throat. Lymph node swelling is prominent, and this is the differential point between the monkeypox disease and smallpox disease. In case of smallpox disease, the lymph node swelling does not occur, while in case of monkeypox disease, the lymph nodes of the body are swollen. Even the superficial lymph nodes of the body, like that of throat, armpits, groin area, these can be felt swollen. This condition is called lymphadenopathy. Lymphadenopathy is present in monkeypox disease and it is absent in the smallpox disease. So, on this clinical basis, both of the diseases can be differentiated. Moreover, the secondary bacterial infections of these lesions may complicate the disease and worsen the condition and increase the mortality and case fatality rate. If the complications occur and secondary bacterial infections are there, then the person may not survive of the disease. The pox-like lesions of the monkeypox disease have 5 stages. These are macules, the second is papules, third one is vesicle, then pustules, and fifth stage is scabs formation. In this first stage of macules, the lesions can be felt on the skin by touching. These are not raised, these are even flat on the skin and can only be felt by touching. The lesion size is less than 1 centimeter. It is the very initial stage of the disease and it may last for 2 days. Then these macules are converted into papules. Papules are the enlarged macules. When the macules are the first lesion size is increased than 1 centimeter, it becomes papules. Their edges are raised from the skin and can easily be seen with remarkable firmness. Third stage is the vesicle formation. Vesicle means that these lesions contain clear fluid. Then when the clear fluid is accumulated in these lesions, it forms vesicles. So vesicles are fluid containing lesions. These also last for 2 to 3 days. The fourth stage is pustule formation. Pustules contain pus in these lesions. So vesicles and pustules can be differentiated on this fluid containing basis. In vesicles, the fluid is clear, while in pustules, the fluid is pus like. So pustules last for 7 to 10 days. Then the fifth stage is scab formation. When the pustules are dried and crusted, the virus dies and the skin lesions become dry. Dried skin lesions are called scabs. These scabs last for 10 to 14 days and thereafter the scabs disappear and the disease diminishes or finishes. So these are the 5 stages of lesions of monkeypox disease if not infected with the secondary bacteria. If secondary bacteria infect these lesions, then these lesions may last for longer time and may also complicate the disease. The disease can be diagnosed on the basis of clinical signs, and for confirmation of the disease, techniques like ELISA and PCR are recommended. As far as treatment of the monkeypox disease is concerned, the FDA, Food and Drug Regulatory Authority, has recommended the use of two antiviral drugs in human beings with the least or minimal side effects. These are cidofovir and bimcidofovir. The cidofovir and bimcidofovir are the two antiviral drugs recommended by the FDA to treat the monkeypox disease in human population. Moreover, along this therapy, you should also continue the antibiotics to prevent secondary bacterial infection, the skin tonics to minimize the duration of lesions on the skin, anti-inflammatory drugs to reduce pain and fever. The antipruritic agents are also used on the skin to reduce the itching. This way, the disease can be successfully treated because it has low mortality rate as well as the fatality rate of the case is also low. And the disease duration is only up to 2 weeks. Thereafter, the lesions disappear and the disease is diminished. Prevention of the disease can be done using the vaccines. Mass vaccination of the healthy community where the disease can spread is essential. The smallpox vaccine has shown 85% efficacy to the monkeypox disease because both of these viruses belong to the family Poxviridae, so they have cross immunity. The smallpox vaccine can effectively be used against monkeypox disease and it showed 85% efficacy. Along with the vaccination, the treatment of the infected people is essential and keeping distance and abstain from the infected people will enable you to manage and prevent the disease. So this was all about the monkeypox disease, its epidemiology, cause, transmission, sign, symptom, diagnosis, treatment, and prevention. So these all factors are discussed in this lecture. Hope this video was helpful to you in learning the medical consequences of the disease.